and you're negative, that's great news. You should still stay home if you're sick and you have symptoms. But if you don't, then you're free to go about your business. In terms of our work, though, following up with people who are presumed to be positive, that's very limited, because as you noted, there's many thousands, tens of thousands of people who are getting tested because they're presumed cases, and the vast majority aren't. So our staff at the Public Health Department is not able to follow up with all of the presumed cases. But what we do is we try to follow up with all the confirmed cases. And this in and of itself is a mammoth task when we have over 4,000 cases, and the number rises by 500 or 600 every day. But what we do try to do is once we get a positive result, we try to make sure we can find the contact information. And I have a team of about 350 people that spend their day trying to call people and talk with people to make sure a couple of things. One is they understand what it means to isolate themselves, and we find out if they're able to do so or they need any help. The second thing is we need to find out if they have any high-risk contacts who they came in contact with, or if they're a high-risk person themselves. High-risk contacts would be people who work in our healthcare facilities, in our shelters, in our congregate living facilities, in our nursing homes, people who work with very vulnerable people doing home care. We want to know about those contacts because we want to make sure those contacts are quarantining themselves. But this is a huge task, and it's difficult. We don't always have good contact information from the reports that come back from the lab. But I want to really express my gratitude for having a team at Public Health that continues to do what we call case identification and contact tracing. Because we also have another team of another few hundred people that also investigate every single case that happens in an institutional setting. So at the first sign that there's a positive case in an institutional setting, we have a team of folks that will follow up to try to make sure that we limit spread, particularly in those settings where there are lots of vulnerable people, nursing homes, assisted living facilities, shelters. So that's really, at this point, more than 700 employees at the Public Health Department that spend their entire day and evenings trying to make sure that we're able to communicate and help people do the isolation and do the quarantine and really shut down outbreaks as much as we can in institutional settings. Thank you.